to talk about that specifically the Panchakarma in the management of chronic diseases and its global future. So I don't know to what audience I'll be in touch with, but this is the perspective which I wanted to talk in terms of the most, I would say, the USP of Ayurveda, the science that is the Panchakarma, and how the futuristic perspective of Panchkaram has established, and what is the scenario at the global outset also. So both things we'll be talking about. When we look into the contents of this presentation, it will be specifically related to some aspects, starting with the introduction, that is the burden of chronic diseases. We'll be looking into the futuristic chronic diseases, the main five pillars of Panchkarma, and we'll be taking some examples related to the Panchkarma in the management of chronic diseases. We'll be talking about the introduction part and the Panchkarma process, what actually this Panchkarma process is, what is the future scope of Panchkarma in India, and what is the future scope of Panchkarma globally, and then be concluding in terms of the potential of Panchkarma also. So this is the whole, my presentation in which it will be segregated. So just to start with, let me talk about some aspects. To start with, the burden of chronic diseases. Friends, when we talk about the chronic disease aspect, it is something we need to look in terms of that to what extent and to what the time period we are looking at, because chronic disease are certain areas of interest where we should have that understanding that this is going to be a very long stage bearing, where more disease orientation phases can be seen. So these are the few growing challenges of chronic diseases, where most important part is the importance of addressing chronic diseases. Globally, when we look into the chronic diseases, cardiovascular diseases, diabetes, cancer, chronic respiratory diseases, neurological disorders, etc., these are the leading causes of morbidity and mortality rates. So when we look into the systemic aspect, these are significantly economic and social burden on each and every individuals, or when it comes to a single entity or maybe their families, and in total the complete healthcare systems, because this is keeping on increasing, and it all depends upon the the lifestyle and the way we are living in terms of our life orientations, and this is increasing prevalence due to the lifestyle changes, as I said, like aging populations, and the major concern nowadays is the environmental factors. When we look into the conventional medicine, they often focuses on the symptomatic management, but when we look into the the Ayurvedic profile and Ayurvedic understanding, we address the chronic disease in terms of the holistic approaches, because we believe that chronic diseases are responsible for the large proportion of healthcare expenditures, because these are the category of disease in which you require more of financial burden, more of time bearing, and they have a significant impact on the quality of life of individuals also. That is the main focus of chronic diseases, because when we look into the chronic diseases, they require a multidisciplinary approach. They may require when we look into the conventional medicine, when we look into the Ayurvedic perspective, or Siddha, or homeopathic, or whatsoever it may be, because as I'm saying, these are time bound. They don't have any time specificity, and they can also hamper the overall health impacts systematically. Okay, so these are the growing challenges of chronic diseases when we look into the aspects of chronic. So what exactly is Panchkarma? In very nutshell, I'm going to tell you that how this Panchkarma, what we call it as the Ayurved's detoxification and the rejuvenation therapy. Some people they call it as the Rasayan therapy, or intoxication methods and different. So these are few nomenclatures, and you can say the synonyms which are being entitled or tagged with the term Panchkarma. But I would say it focuses on the four important parts. Now, what are those four important parts? One is a comprehensive system of five, that is Pancha therapeutic procedures, that is Karma in Ayurveda. It is extremely important. This particular therapy focuses on eliminating accumulated toxins, that is what we call it as the arm, from the body and restoring balances of the doshas, that is vata, pitta, and kapha. Number three, more than just detoxification, I would say, it's a holistic approach addressing the root causes of imbalances. So, as I was saying in my earlier slide, when we look into the chronic disease, Panchakarma is the best methodology we can have, or the best procedures we can have when we look into the chronic aspects of any kind of a disease, whether it is from the individual entity or in terms of different multi-centering systemic approaches. And number four, it also emphasizes personalized treatment based on individual constitution and current imbalance. Many a times there we have this kind of a dilemma, or this kind of a doubts in our mind that when we talk about the Panchkaram, that means five procedures. We have to undergo all the five procedures in all the conditions, but it is not like that. So it is a very personalized, customized treatment, and it all depends upon the individual constitution, that is specifically on the prakriti and the vikriti aspect. What is their natural, harmonization and the current imbalances related to the tridoshik effect, whether it is related to the vat, whether it is related to the pith, whether it is related to the kaph. So, like in terms of that, we can have customized or personalized treatment related to the woman, where we go for MSS, making the person do the vomitus. We can plan for basti, that is, I would not say it is an enema, but it is an Ayurvedic detoxification enema process, which is very useful for the Vata dosh. And then we talk about the Virechan, right? So, like, these are the things in terms of individual constitution and the Tridoshik effect based upon the personalized treatment related to Panchakarma. So, what are the five pillars of Panchakarma? We have always known, we always talked about these five pillars, that is Vaman, Virechan, Basti, Nasya, and Rakta Mokshan. When we look into the Charak aspect, he has excluded the Rakta Mokshan, and Sushrutacharya has mentioned about the Rakta Mokshan. So, understanding these five therapeutic procedures are of utmost importance. It's not like something we are doing it haphazardly and something we are just not taking care of any individual or something like that, because it requires tremendous understanding that where we are actually ending up and what we are planning for. So when we look into the woman aspect, that is the therapeutic emesis, it means like induction of vomiting to eliminate excess kapha, which is extremely useful in respiratory conditions and some metabolic disorders. So this is what the plan could be. And when you look into the variation aspect, it is a therapeutic. See, I have used the word therapeutic instead of just writing MSS or purgation, because it is a well planned, balanced therapeutic, or what would I say, like a management protocol, which can control elimination of excess pitta through purgatives, beneficial for digestive issues, skin disorders, and liver conditions. So I would say like Virechan is such a process, friends. Like out of all the Panchkaram, when we talk about the five procedures, Virechan stands at one another level where we can plan the Virechan in terms of just looking at the gut intolerance of a patient, metabolic disorders, digestive disorders, or absorption related disorders. Considering that Virechan stands has its own role and impact and emphasis on the GIT related issues. And I am practicing in dermatology in our Agatantra OPD at ITRA Jamnagar, Gujarat, India, where we are doing variation on a very like common protocol basis. Like in very good results of variation we are getting in skin disorders related to dermatological in terms of vichurchika, eczema, gadru, some fungal disease like tinea corporis. We are talking about ekukosht, like in terms of psoriasis, right? So, like even in a simple mukh dushika, that is acne related issues, or some melasma where you have hyperpigmentation of the skins and everything. These stands very good, effective single entity role of Virechan. So these are very important protocols, when we talk. But Virechan has its own, individualized entity. Similarly, Basti, it is a therapeutic enema, which introduction of medicated liquids into the colon to balance vata, crucial for neurological disorders, musculoskeletal issues, and overall rejuvenation. Basti, again, like Basti has its own, individuality, which is very important in terms of, talking about vata disorders or vata vyadhi. Similarly, Rakta Mokshan, bloodletting, therapeutic removal of impure blood used cautiously for skin diseases, inflammatory conditions, and some, Rakta Pradoshas or some blood disorders. Nasya, nasal administration, again talking about therapeutic instillation of medicated oils or powders through the nasal passages, very useful for the upper clavicle related issues to the CNS, peripheral nervous systems, in terms of when we talk about the sinus or pratishay, gene pratishay, I would say like chronic sinusitis and chronic rhinitis. Extremely good results. So we need to understand these five therapeutic procedures in terms of their systemic and individualized effects also. So let us see some of the examples in the management of chronic diseases, how we can understand from that. So certain chronic ailments which we are taking care of through the Panchakarma in terms of as a pure holistic, where not only Panchakarma but along with that we are taking care of chronic ailments also. So diabetes mellitus, which is very commonly seen, as I would say the most typical and peculiar lifestyle related disorder, that is Madhumeha. Virechan is a very important protocol in that. Virechan can help improve insulin sensitivity and manage blood sugar levels, along with Basti, which can support overall metabolic balance. So out of see, it's not something we are going for all the five procedures. We need to be very selective, individualized, looking into the chronicity, severity, the condition of the patient. Age factor plays a very important role selecting the specific Panchkarma procedures. Similarly, in cardiovascular diseases, that is the Hridrog mentioned by Acharya Charak, specific Basti therapies and gentle viration can aid into managing cholesterol levels and reducing arterial plaques, but provided it should be done under strict medical supervisions. Abhyang and Shirodhara can reduce stress, a major risk factor. Most of the cardiovascular diseases are stress induced, where psychosomatic issues are seen on the very higher side or the chronicity. Again, it's a lifestyle disorder. Then rheumatoid arthritis, that is what we take in terms of Amavata from Ayurvedic perspective. Panchkarm aims to reduce Ama, which are the major toxins, I would say the harmful factors which are, or rather, we can understand in terms of free radicals, which are considered a root cause for any kind of a systemic related issues. Basti and Virechan are often employed to reduce the inflammation and the pain factors related to the Amba. Chronic respiratory diseases, that is Shwasarog, Vaman, extremely important procedure of Panchkaram, which helps eliminate excess kapha from the respiratory tract. Nasya can clear nasal congestions and improve breathings. So, in terms of upper respiratory tract and in terms of lower respiratory tracts, Vaman and Nasya plays a very important protocol when we look into the procedurals from the Panchkaram side. Similarly, certain other examples we can take in terms of management protocols. But make sure, friends, that I'm talking from the holistic management. Along with Panchkaram, we need to look at the psychological aspect. We need to look into the lifestyle orientations. We need to look at the Nidan Parivarjan. What are the causative factors which are taking? So Pathya also plays very important role. Do's and don'ts. Okay. So neurological disorders, something what we understand from the Vata Vyadhi side. Basti is considered as the primary treatment to balance Vata, but Shirodhara and Abhyam can calm the nervous system and improve sleep also. Again, which is very important factor in terms of any neurological disorders. Similarly, digestive disorders, Grahani, Agni-mandya, Ajirna, Amlapit, etc. Virechan helps in eliminating accumulated toxins. And Basti, very importantly, specifically, I would say the Matra Basti concept, which can regulate bowel movements and improve gut health. In the routine practice also, we are practicing in terms of, say, Kshir Bala, Tel Basti, in terms of Matra Basti, which is taken to as a Nitya Basti, which actually improves the gut tolerance also. So, Kshir Bala Tel, then Bala Ashwagandhadi Tel, right? These are some of the examples in which Basti has its very important practicality. Mental health disorders in terms of Manovikar, Shirodhara, Nasya, and Abhyam can help reduce stress, anxiety, and improve mental clarity. Virection can aid into detoxification also. So, like upper, CNS related issues, Shirodhara, Nasya, with see Jyotishmati Tel, Anu Tel Nasya, Shadbindu Tel Nasya, Goghrit Nasya, Dhanvantar Tel Abhyang. These are very important protocols in terms of Shirodhara, Nasya, and Abhyang. Then chronic skin diseases in terms of what Acharya Charak has mentioned as 18 types of a Kushtha Vikar, whether it is Shudra Kusht or Mahakusht. Virechan and Raktamopshan are often used to purify the blood and reduce inflammation. Jaloka Avacharan, leech application, cupping methods, Shiravedhan, sections. These are very important protocols when you look. But as I was saying earlier also, I'll keep the words intact that it all depends upon the severity and the intensity and the condition of that patient. It's not always necessary that we have to follow all the protocols of Panchkarma. As per the selection and the category, we can move ahead like that. Okay. So as I said, Panchkarma is not just merely a therapeutical procedure, it's a holistic approach because we are also taking care of a patient from the psychological aspect because it is not always easy to follow the instructions what a doctor or physician is telling to a patient. He might ask you back that what will happen if I do more of a vomiting, what will happen if I'll have a more of a variation like diarrhea, whether there will be weakness, whether there could be any dehydration, whether there could be anaphylactic shock or something. So these are all holistic approach where we are taking care of the patient from the psychological aspect also, from lifestyle oriented also, from food aspects also. So Panchkarm, friends, it is more than just a procedure. It's a holistic Panchkarm journey because there you all might be aware about this that we have Purvakarm, Pradhankarm and Paschatkarm. How we are addressing that? That is the preparatory procedures in terms of Purvakarm where Snehan and Swedan like application of oil on the body in form of Abhyang, Swedan in terms of hot water fermentations to loosen the toxins and prepare the body for the main procedures. When we look into the Shastras, so classically they have very, authentically and validated the concept that bringing the doshas from Shakha to Kosh, Purvakarma in terms of Snehan Swedan is extremely important. Unless and until we do this Snehan and Swedan, the intensity of the Panchkam procedure is not going to give you the desired results. It can lead to certain complications in terms of Heen Yog, Mithya Yog, Ati Yog, or Ayog also, right? So, like it can happen on any other, in terms of I would say the ADRs, adverse drug reactions. So, Purvakram is a very important procedure in terms of Panchkar. Then we go for Pradhankam, that is the main procedure where we are actually following those five procedures. As I said, Vaman, Virechan, Basti, Nasya, and Shirodhara or Raktamoksha. So again, I would say that these are tailored based individual needs. We can plan accordingly. Not all the procedures are required to be done on the actual sites. Then Paschatkarma. I would say that this third part, that is Paschat, this is the most important therapeutic regimen. Because once the patient has followed the Purvakar, Pradhankar, his or her Jatha Agni, that is the fire of the digestion, it goes down. So Jatha Agni Mandyata will be there, and outrightly patient cannot be on the specific, sorry to say not specific, but common diet, like start eating veg, non-veg, and immediately, because those are the procedures in which the digestive fire loses its intensity. So specifically, some dietary procedures, life recommendations to rejuvenate the body and maintain the balance. That is what we call it in terms of Sansarjan Kram. So when we look into the holistic approach of Panchkarma, it emphasizes on the personalized care, including consultations, dietary guidance, and lifestyle modifications. So again and again, I am repeating that it's a complete holistic Panchkarma journey. And it all depends whether the person is Swasthasya Swasthya Rakshana or whether he is in Aturasya Vikar Prashmanam category. Whether he wants to be healthy or whether he is unhealthy and wants to be healthy. So both concepts in terms of five tailored procedures we can plan accordingly. Let us see some of the future scope of Panchkarma in India, where actually Panchkarma has a very promising future in India because I've used the word as USP. And Panchkarma is something like you need mastery in that. It's not something like merely just cleaning the body or cleansing the body. It is a beyond that because it's a holistic approach. So the future in India is that it has an integration with the mainstream healthcare now. All right. So it keeps on increasing the acceptance and potential for collaborative care models, especially for chronic disease management and even nowadays for the palliative care. People are looking into the Panchkarma sector to be on the healthy perspectives, to maintain the health, swasthasya swasthya rakshana. But more importantly, Panchkarma nowadays, it is based upon research and validations. because it requires more rigorous scientific research to validate the efficacy of Panchakarma for specific chronic diseases conditions now. So many research which have been done in previously in IPGTNRA and now ITRA, and altogether in National Institute of Ayurveda at Jaipur, India, then All India Institute at New Delhi, India, and maybe in your places also it might be happening. But now research updations are something which gives you evidence-based data, documentations. So whether it can be funded from the government side or the private side, but now research initiatives to individualize the Panchkarma procedures in terms of specific chronic conditions. That this procedure should be done in this procedure when it comes to the chronic condition. It is very important nowadays. Then we talk about standardization and quality control, establishing the standardized protocols, training programs, and quality control measures to ensure authenticity and effective treatments protocol. As I already said, that Panchkarma is not something like it's a cup of tea of everyone. And it is not merely that you are asking the patient to drink so and so medicine and then start vomiting or viration or something. It has its own pros and cons. So standardized protocols should be there that we have to follow Purva Karm, Pradhan Karm, and Paschat Karm. More emphasis should begin on the Paschat Karm because that is the most neglected part. Patient can take, grit or tail for drinking and everything, but after Panchakarma, the Sansarjan Karma is something where you need to put more emphasis that these are the things which needs to be taken care of. Like starting with a simple, for example, in the cases of skin disorders, when we are talking about the Kushtvikar, we ask the patient that you start with a simple green moong water. Boil the green moong, dal, cereals, and take the water out of it and drink that. Then go for rice water. Then go for simple starting of mashed moong. So gradually it can be taken from simple liquids to semi-liquids, then to semi-solids, and then gradually take the patient to the solid criteria also. But most importantly, nowadays, Panchkarma is being attached by the government of India and Ayush sector in terms of medical tourism. So, which is a more potential in terms of India's credibility. Like India has the potential to become a global hub for authentic Panchkarma treatments, attracting health tourists seeking holistic therapies in Jamnagar with its Ayurvedic heritage, which can play a significant role. So it's a very promising future. Like so many of you, like Dr. Mohammed and I can see some other people, they have joined in over here. Fernando also. So they were in the Jamnagar, so they have seen how people they are getting treatments related to the Panchkarma sectors over here. So government support and policy also, supportive government policies promoting Ayurveda and Panchkarma can drive its growth and integration. And most importantly, when I talk about the Panchkarma in terms of education and awareness, increasing awareness among the general public also now. People are getting to know that what exactly is Panchkarma. They are so promisingly interested in understanding that how this Panchkarma is working. It is something like it is giving a new life to the public domain. So they need to know the benefits of Panchkarma. It's a pure rejuvenative rasayan entity and technological advancements, incorporating technology for better diagnostic, treatment monitoring, and data collection in Panchkarma practices, which is extremely important. So, futuristic plannings of Panchkarma in India are in the concepts of these planetary designs. When we look into the Panchkarma as a global sector or the global perspective, I would say that there are 6 points which categorize the global potential and growing interest in Panchkarma. Number one, as I said, it is having a rising interest in holistic and complementary therapies, growing global awareness of the limitations of conventional medicine for chronic conditions, and a desire for natural and holistic approaches. Because when you look into the chronic disease aspect, no, conventional system of medicine, they don't have much to say. We, as an Ayurvedic people, we have the tremendous output and tremendous interest and output when we talk about the Panchkarma, because it has a potential for collaboration between Ayurvedic practitioners and conventional healthcare providers globally for integrated patient care. See, when we talk about the integrated patient care, I mean to say that people from conventional medicine, people from Ayurveda, people from homeopathic and Ayush sector, considering Ayurveda, Yoga, Unani, Siddha, and homeopathy, We should have an integrated approach in terms of chronic diseases. Say, for example, cancer, a world outbreak. So how this integrative approach in terms of Panchkarma from the Ayurvedic side, then conventional system like radiotherapy, chemotherapy from conventional system, then other system of Ayush they can incorporate in that. It requires these kind of a holistic approaches. But simultaneously, I would say that there are challenges and opportunities also, which need to address challenges like lack of standardization, regulation, and qualified practitioners. Most importantly, in many countries, as I'm saying, it's something like after getting graduation in DHMS, everything, people they start doing Panchkarma, but then understanding the Panchkarma from the criticality point of view, complications point of view, and handling all those conditions means a lot. So opportunities lie in education, research, and collaboration. Right. Then fourth point, I would say that it has an increased research and publications issue also. Gradual increase in scientific studies on Ayurveda and Panchkarma internationally. Like there are so many international journals when you talk about, like we have from ITRA that Ayu journal, then you have Ayu Care journal from All India Institute, then Journal of Ayurveda from NIA, then Ayurveda Shala Protocol journals are there, then JAIM from the Dr. Bhushan Padwardhan, which is related to the World Ayurveda Congress. So these are well-known, reputed index journals, peer review, where these articles are getting published and showing the well-being and the effective benefits through Panchkarma. And people can, access those articles on the public domain also, print, online, both. So both from the students' point of sector, scholars' point of, they should know that how authentic and how reliability and rationality of Panchkarma procedures are there. Establishment of Ayurvedic centers and spas. Now the problem is Panchkarma is being taken in the concept of spas now, which is a major hindrance and flaw. It should not be like this. Growing number of Panchkarma centers and Ayurvedic spas worldwide indicating increased demand. Obviously, there is increased demand, but spa and Panchkarma are both not the same side of one coin. Panchkarma is a holistic approach, and spa is something in terms of a generalized wellness. So Panchkarma is beyond that. Panchkarma is not just mere the generalized healthcare or wellness sector. It is beyond that because it is a psychosomatic issue or the holistic approach. So that is why I'm using the word integration in wellness and lifestyle programs. Panchkarma principles and therapies are being incorporated into wellness retreats and lifestyle management programs globally. So all these things are actually helping us to understand that to what extent and level Panchkarma is growing rapidly, not only at the India country as a country, but globally perspective also, that people have inclination towards this. And friends, we have interestingly seen the scientific or significant rise in the Panchkarma post-COVID also. Until date, like how people they are inclined towards Panchkarma, they are so interested to understand the Panchkarma concepts and the understanding of this. This is really helpful and understanding the the approach in terms of therapeutically, also in terms of detoxification, and altogether in terms of holistic approach. So thank you so much for patience listening. I'll wind up over here. On the last note of my lecture, I would definitely say that Panchkarma is an Ayurvedic art and science of detoxification and rejuvenation. So this is extremely, point of interest that people should understand that what exactly is Panchkarma and how we are approaching in terms of its understanding and utility. So once again, thank you so much for patience listening. If any queries, if any questions are there, I'll be happy to take those. And thank you once again. Thank you. Hello.
Yes, sir, we can hear you.
Okay. So I've just ended my session over here. If any queries or if anything is there, I'll be happy to take them.